Organisasi Kesehatan Dunia World Health
cases have been
Organization
confirmed
menegaskan
as
bahwa kasus
hantavirus,
infeksi yang muncul
and
di
the
kapal
other
pesiar
three
MV
are
Hondius bukanlah
suspected.
awal dari pandemi baru seperti COVID-19,
Hantaviruses are a
meskipun
group of
sempat memicu
viruses
kekhawatiran
carried by
global.
rodents that can cause
Direktur
severe
Jenderal WHO
disease
Tedros
in
Adhanom
humans.
Ghebreyesus menyebut sebagian besar
People
kasus
are
telah
usually
terkonfirmasi
infected
sebagai
through
hantavirus,
contact with infected
sementara beberapa
rodents
lainnya
or
masih
their
dalam proses
urine,
pemeriksaan.
droppings, or saliva.
WHO juga telah menginformasikan
The
sejumlah
species of
negara terkait
hantavirus
penumpang yang pernah
involved in
berada
this
di
case
kapal
is the
tersebut.
Andes virus, which is found in Latin America and is the only species known to be capable of limited transmission between humans. In previous outbreaks of Andes virus, transmission between people has been associated with close and prolonged contact, particularly among household members, intimate partners, and people providing medical care. It's possible that more cases may be reported. While this is a serious incident, WHO assesses the public health risk as low. It also shows why the international health regulations exist and how they work. WHO is working with multiple governments and partners on the response under those regulations. Our priorities are to ensure the affected patients receive care, that the remaining passengers on the ship are kept safe and treated with dignity, and to prevent any further spread of the virus. WHO has also informed 12 countries whose nationals disembarked in St. Helena. Those 12 countries are Canada, Denmark, Germany, the Netherlands, New Zealand, St. Kitts and Nevis, Singapore, Sweden, Switzerland, Turkey, the United Kingdom, and the United States of America. In addition, WHO is supporting health authorities in South Africa to follow up people who were on the flight from St. Helena to Johannesburg with the woman who later died. Meanwhile, investigations into the cause of the outbreak are continuing. Prior to boarding the ship, the first two cases had traveled through Argentina, Chile, and Uruguay on a birdwatching trip, which included visits to sites where the species of rat that's known to carry Andes virus was present. WHO is working with health authorities in Argentina to understand the movements of the couple, and I thank the government of Argentina for its cooperation, given its experience and expertise with Andes virus.
We certainly advise people who are caring for those who are suspected of this Andes virus or hantaviruses to wear a higher level of personal protective equipment. That guidance has been given to the people on board, but also there are the two patients that are in hospital in the Netherlands, and there's a patient in ICU in South Africa. And I am very happy to say the patient in South Africa is doing better, and the two patients in the Netherlands we hear are stable. So that is actually very good news. So we have a situation that we are monitoring very, very carefully. As you probably know, those who develop symptoms, those who go on to develop disease, sometimes develop very severe disease, which includes severe respiratory disease. So there may be some coughing, there may be some aerosolizing procedures that may be done. And of course, that's where we would require higher level care. So this is not COVID, this is not influenza, it spreads very, very differently. So there are different precautions that people are taking. So we are supporting the ship's operators in the mitigation measures that they are putting on board. And as we've said, we are working to have a proper and full disembarkment procedure step by step to support authorities in the Canary Islands for the next stage of the people who are on board. We know this virus, hantaviruses have been around for quite a while. There's a lot of detail that we know. I'm going to ask Anais to come in and say this, but I want to be unequivocal here. This is not SARS-CoV-2. This is not the start of a COVID pandemic. This is an outbreak that we see on a ship. There's a confined area. We have 5 confirmed cases so far. We completely understand why these questions are coming, and we are trying to provide all of the information that we can. That's why we're having a press conference here to give accurate information, and we're grateful for all of those who out there who are asking these types of questions.
Health security needs universality, and any vacuum any space which is not covered actually gives advantage to the virus. And the best immunity we have is solidarity. So because of the event that's happening now, and both Argentina and the US are affected, I think they will reconsider their decisions because they can see how important universality is for health security. Because viruses don't care about our politics, and they don't care about our borders, and they don't care about all the excuses that we may have.
Jelajahi cara baru mendapatkan informasi. Download Metro TV Extend sekarang.